Gynecologist, what is the nastiest thing you have experienced while working? Bon appetite. I'm on placement as a scrub nurse for a gyne theater. I've seen many gross things in my time here. Mostly it's been terrible smells and a whole load of prolapses. But one case really sticks in my mind. This poor woman came in with cervical cancer, and she got treated for it with chemotherapy. For some reason, I do not know the medical technicalities behind this. Her rectum and vagina fused, and any bowel movement she had would erupt furiously out of her vagina. She was also very overweight, so she could not properly clean herself, meaning all the festering feces and general uncleanliness had caused everything down there to start rotting. Nurse here. I had a girl come into the emergency room walking funny. She was complaining of pain near her vagina. She had an ingrown pubic hair next to her vagina that was infected and created a 4-centimeter lesion of pus and stench. The physician assistant and I had to drain the vesicle. I think I screamed louder than her when it popped while the physician assistant was injecting some lidocaine to numb the area. It is sad. With no insurance, the poor girl let it go for so long before she spent the money for a doctor. My wife is a urologist, and increasingly more of the issues handled by a gynecologist are being recognized as appropriately handled by female urology. Her worst experience was as a medical student visiting at a Midwest medical school. The patient was an insanely morbidly obese woman whom they had to keep in the hospital for days until a new table, capable of supporting her, could arrive. When the time came for the exam, they had to assign a medical resident to either side of her to hold back her panties. Google it, just to get access to the labia. We are not talking about holding fat up. We are talking about holding fat back side to side like a barn door. When they finally got it open, the aged attending physician, who had seen it all, had to turn away from the stench to avoid vomiting. Since my wife was just a medical student, she was observing from a reasonable distance, but said her favorite part was watching the faces of the residents left holding the panties as the attending fled. I worked as a medical assistant in a gynecology office, and the worst patient we ever had was actually really sad. She clearly had not bathed in about a week, and her underwear was stained. She claimed she was having trouble getting pregnant and had a bunch of eggs frozen and wanted a pelvic exam. The smell when she took her pants off was horrific. I am fairly certain she had mental problems because she proceeded to tell me that she knew how to kill a man and get away with it and could help me out if I ever needed it. Then there was the time I had a 98-year-old patient with severe uterine prolapse. It was horrifying and made me never want to get old. The most interesting thing I ever saw was a patient who was originally developing as a fetus with 2 vaginas, but they ended up fusing together, leaving her with a string of flesh that divided her vagina into 2 sides. She did not know about it until she was 19, when the doctor had a difficult time putting in the speculum because he stuck it into the side of the string that was smaller. Before that, no one had ever noticed. Too long. Did not read, dirty crazy lady vagina, 98-year-old whose uterus was falling out, and a girl with a flesh string dividing her vagina into 2 sections. My mom is a labor and delivery nurse, so she sees quite a lot of cooch and swap stories with gynecologists all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy stuff they put in Easter baskets, out of a vagina. She did not ask, and the patient did not explain. I was assisting with a pelvic exam in the emergency department. The patient's chief complaint was, "Gauze stuck in my vagina." I thought she was full of it because she was 6 weeks postpartum and had already had a follow-up gynecology exam. But sure enough, we pulled out 3 nasty 4x4 South that had been in her vagina since delivery. Now I have been a nurse in the intensive care unit and emergency department for nearly 7 years, and that was by far the foulest thing I have ever smelled or seen. She is lucky she did not get toxic shock and die. As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was in labor. After several attempts, I just could not get an accurate view with the speculum due to the sheer size of this lady. As such, I had to call my resident in for help. As the resident attempted to do a speculum exam on this patient, her first couple of attempts were unsuccessful, as mine had been. However, on her 3rd attempt, she was able to pass the speculum into the vaginal cavity. Then the patient all of a sudden started screaming really loudly. We were not really sure what happened, but upon closer inspection, the woman's panties, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I have ever seen. Worked for a family practice as a medical assistant for a while. A patient whom we had never seen before called the office frantically trying to schedule an appointment because she was having lady issues, whatever. We got her in the same day, and after the doctor had talked to her for a while, he told me to prep a pap room dot. When we walked into the room, the smell hit us like a ton of bricks. The doctor cleared his throat a few times and sat down at the end of the bed to start the exam. Well, after getting her feet in the stirrups, he lifted her gown, and his eyes went from normal to about the size of dinner plates. This girl had the most severe case of herpes I had ever seen. Her vagina was swollen and a deep red color, covered in a severe outbreak. To make things worse, the piercing she had in her clitoris looked like it was being sucked in by her skin. Her vagina was oozing green and black discharge. And when the doctor inquired about a perineal tear, she responded, "Yeah, have you not ever heard of double penetration?" After the exam was over, we had to convince her that her 4 current sexual partners needed to be contacted about their exposure to several sexually transmitted diseases. Even though, as she put it, it was too late anyway because she never uses a condom. I have never seen anything so disgusting in my whole life. It still haunts me. Cadavers are embalmed and have a sickly sweet yet meaty odor. When I was a hospital corpsman in the Navy, I worked in family practice for a little while. We had a woman come in with a Bartholin cyst on her labia. She was also HA positive, hepatitis C positive, and had genital herpes as well. She was very prone to infections. I think she said the herpes outbreak caused the cyst to form. The doctor decided to lance open this huge, angry cyst. I was in the room as the chaperone and assistant. I am also pregnant with my son at this time and was not allowed to opt out of this procedure. He used a drape to cover her vaginal area, used a betadine solution to sterilize the cyst, injected some lidocaine, and sliced that monster open. Instantly, this cyst started gushing out green, yellow, and brown fluid mixed with a little blood. The room filled up with the stench of old vaginal odors and infection. Worst odor in the world behind decomposing human flesh. The room became incredibly hot and stuffy. I thought I would pass out at any moment. He squeezed that cyst over and over until it no longer had any pus. Since it was such a big cyst, the lidocaine did not help much. Lidocaine also gets sucked up by pus and is not absorbed as well. This poor woman cried as silently as she could while he did the squeezing. He then cleaned out the inside and irrigated the incision. He packed it with iodoform gauze and dressed her now very painful labia. I was on the edge of vomiting the entire time, and to this day, I am not sure how I managed not to vomit. I cleaned up the room, red-bagged everything, and then went into the staff restroom to vomit for 10 minutes. Have no idea if this woman is still alive or if she has passed away. I never judged her, but I figured she had a pretty hard life. Getting hepatitis C, herpes, and HIV was probably the last of some really painful experiences for her. When my husband was an intern at a public hospital here in Brazil, he told me about 2 nasty cases. A woman walked in complaining of a foul smell in her vagina. Upon closer inspection, the doctor pulled out not 1 but 3 condoms that were lost in there. She said that the last time her boyfriend had lost a condom inside her had been about a month before. Same complaint, foul smell. The doctor examined her and found pieces of raw, rotten beef. The lady explained that she left a piece of steak in there for about a week so she would cook it for her boyfriend and they would be together forever. And that was when I lost my faith in mankind. So she would cook it for her boyfriend and they would be together forever. That turned very crazy, very fast. Probably one of the least disgusting causes of a problem throughout most of these stories, but by far, for me at least, the most disturbing just because of the crazy involved there. My friend's wife is a nurse at a sliding scale clinic, and he related this story, which has become legend in our circles. A woman walks in and steps up to the reception desk. They ask her how they can help her, and she says quite loudly, "I think I got bugs in my monkey." To which the whole reception room chuckles, but whatever. So they have her fill out the intake form, which she does. She goes into the exam room when they are ready, and the nurse asks her a few questions. Noting that the patient also indicates a bad smell and foul discharge in addition to the itching, she instructs the woman to disrobe and says that the female doctor will be in shortly. The doctor, an accomplished veteran, walked into the room and had to walk right out. It turns out that the patient did not have any sort of crab lice. The bugs were maggots. Her entire anal and pubic region was covered in maggots. Her vagina was covered in a thick, smelly layer of blue slime. From anus to clitoris. The hair was thick and matted and nasty, but the smell was something that the veteran doctor was unprepared for. Keep in mind that this is someone who has probably seen and smelled gangrene, human decomposition, whatever. The indescribable smell was so bad that they could not use that exam room for the rest of the day. A funk lingered in the office for a week. A funk that spread out of the doctor's office and into the hallway. They eventually hired a medical grade crime scene cleanup crew to come in and sterilize the room. A slightly nasty odor remained present in the office for 6 months. What caused all this? 7 tampons left up there. They had all turned blue and fused into a superclot of concentrated evil. This will probably get buried. But my father and mother are both obstetrician gynecologists, physicians, and have been practicing for more than 30 years each. My mother describes her worst experience as a patient who left a tampon in during month 1. During month 2, she put another tampon in. During month 3, she put yet another one in. My mom has a pretty strong stomach, but she gagged as she pulled that out. The whole office stunk terribly. She said my father's experience is not really nasty, but pretty terrible. My dad is on call and is called in to stitch up this girl, 16 years old, who goes to a rival high school of mine. He spends 2 hours or so. I guess that is a long time. I do not know really, stitching her up from her belly button to her anus. Somewhere along the line, he notices that she was pregnant. After he is done, the father of the girl is there, and my dad just says, "Where is the baby?" The father freaks out and screams at my father. "What are you talking about? My daughter is not pregnant." Scream, scream, scream. The police go to the girl's house and find the baby in the closet with a sock in its mouth. The guy freaks out and asks my dad what he should do. My dad just says, "Get a lawyer." The girl got off too. I doubt anyone will see this. But I used to work for a urologist, and one night he was on call for the local hospital, and a morbidly obese woman came in with painful urination and hematuria, blood and urine. Due to her size, they decided to put her under anesthesia and do a cystoscopy to see if there was anything unusual about her bladder. Once they had her on the table, the doctor spread her legs. He said the first thing that hit him was the smell. It was atrocious. He went on to find what looked to be a smashed and rotted sandwich in the folds of her buttocks and thigh area. Once the patient woke up from the procedure, he asked her about it, and her reply was, "Oh yes, I did lose a sandwich a couple of weeks ago. I just thought I ate it and forgot." This is a true story. Too long. Did not read. A urologist I used to work for found a rotted sandwich in a lady's buttock and thigh rolls. I am going to cry. Nurse here, 100% believe this. I have found a remote, sandwiches, hard fingernail clippings, layers and layers of yeast infection, cheese, as I call it, and many other things I choose to block out. If you see what 350 pounds or more of fat looks like naked, you will block it out also. This reminds me. We had a solid 400+ pound woman come in 2 weeks ago for a urinary tract infection. Upon arrival, the smell made me want to take a fire hose to her, while the technicians, 4 of them, lifted up layer after layer of fat. In order for me to locate her vagina and insert a Foley catheter, it required the help of 8, yes, 8 people. 3 holding each leg, 2 holding the stomach and fat surrounding the vagina, just so I could try and locate it. We did not do that, obviously, but the smell was atrocious. We asked her how she bathed herself down there, to which she said her husband did it when it got bad. At this point, I am wondering what she thinks bad smells like. I am at the point of needing an N95 mask. I work at a hospital in England. A story was told to me the other day of a lady who came in with a toilet brush stuck inside her, placed by her kind husband. Now, she had it in for days before gaining the gumption to come to accident and emergency, where they tried to remove it. However, even the surgeon could not remove it. They realized it was somehow twisted around her femoral artery, as it had gone through her uterus and abdominal cavity. It was impossible to remove without her bleeding to death. Within days of this, the doctors found she had septicemia, as they assumed the toilet brush had not been cleaned before inserting. She died a quick and painful death. My sister's boyfriend was doing a gynecology rotation. He was quite upset, as he was examining a woman that, from sight and smell alone, it was obvious she had cervical cancer so advanced that she was not going to make it. For the first time on that rotation, he had to warn someone about their imminent death. It was all very depressing and solemn. So it was quite a relief when it turned out to be a tampon that had been in there long enough to resemble a tumor. Nurse here. I had a girl come into the emergency room walking funny. She was complaining of pain near her vagina. She had an ingrown pubic hair next to her vagina that was infected and created a 4-centimeter lesion of pus and stench. The physician assistant and I had to drain the vesicle. I think I screamed louder than her when it popped while the physician assistant was injecting some lidocaine to numb the area. It is sad. With no insurance, the poor girl let it go for so long before she spent the money for a doctor. Surgeon here. I was doing a pediatric surgical rotation when an 8-year-old girl was brought in by her parents to the emergency room for vaginal bleeding. I was called in to have a look at her because the nurse could see something inside. Yes, there was stuff inside, and lots of it. Pencils. She used to pleasure herself with pencils. We took her to the operating theater and removed more than 20 pencils from her, scarred for life. I can never look at pencils without remembering that I am a critical care nurse. And we had a prostitute brought in through the emergency room, and she kept reaching toward her vagina, shouting that she had stuff in there. We looked at each other and thought, oh no, now we have to look. We proceeded to pull out toilet paper, $32.50, and a handful of maggots. Almost all of us gagged. My wife is a urologist, and increasingly more of the issues handled by a gynecologist are being recognized as appropriately handled by female urology. Her worst experience was as a medical student visiting at a Midwest medical school. The patient was an insanely morbidly obese woman whom they had to keep in the hospital for days until a new table, capable of supporting her, could arrive. When the time came for the exam, they had to assign a medical resident to either side of her to hold back her penis. Google it, just to get access to the labia. We are not talking about holding fat up. We are talking about holding fat back side to side like a barn door. When they finally got it open, the aged attending physician, who had seen it all, had to turn away from the stench to avoid vomiting, since my wife was just a medical student. She was observing from a reasonable distance, but said her favorite part was watching the faces of the residents, left holding the penis as the attending fled. A couple of years back, during medical school, I was doing my obstetrics and gynecology rotation. I had this patient with clear signs of infection and some exams, like ultrasound, pointing toward a gynecological origin. So the patient underwent surgery to remove the abscess. She was a bit big for a girl and also had way too much hair. So we opened her up and started looking for common structures. Nothing, no uterus, no ovaries, nothing. Very weird. We kept on looking, and there was a weird mass near the bladder. We started getting a better look and realized it was not a weird mass. It was the prostate. After we woke her up, she confessed to having a sex change operation a couple of years back. How she ever got the fake exams, we will never know. We still laugh at the surgeon for having performed gynecological surgery on a man. Thanks for watching. Write in the comments, gynecologist, what other cases you had, and check out my other videos too.